Yes, I know. It wasn't that long ago when I was saying, hold on, I'll be right back. I've got to have a doctor's appointment and I'm going to give you the results when I get back. And then here I am, like, I don't know what, 2 months later or something. Will I ever improve? That is the question. I don't think so. There's not much hope. This big thing came barreling down the hill called life, and I just spun out of control. What can I say? I did want to get back to you guys because I wanted to tell you the news, and I did find out a lot, and I dealt with a lot of frustrating things in the process. One of them was the fact that I did not know that as a bariatric patient, good luck if you move, because you're not going to be able to get in to see any other bariatric surgeon. Most of the time they will not see other patients unless they perform the surgery. So I called, 10 here in Georgia, and nobody would see me, which left me really feeling depressed at the time because I felt like there was little hope. My primary care physician really understood about this much about bariatric patients, and in fact, I almost felt like she didn't take me serious, which kind of ticked me off. I was explaining to her my symptoms, my problems, and she just sat there looking at me going, you're tired. Yeah. And I thought, okay, she's not understanding the seriousness of my problem and the lack of my vitamins that I'm getting in, and that I feel like my levels are low. So she did go ahead and she ran my levels, and it turned out that I was extremely low. My ferritin was like a 5, my hemoglobin was like a 9.5. I had low vitamin C, low vitamin A, low vitamin B12, and so they prescribed me pills. My question to her was, will these pills help me? If I'm this low and I have a malabsorption issue, am I going to be able to recover these quickly? Am I going to be able to recover them at all? And she said, I don't know. Talk to your surgeon. So I was feeling a little upset. I did finally get a hold of my bariatric surgeon, and he told me that because my levels, especially my ferritin levels, were so low, that I would not recover my levels by pill form alone, and that I required IV treatment. So I have since had a 6-hour, actually a little over 5-hour IV treatment, and I did feel a lot better after that. And I'm happy to say that I have been taking my vitamins and supplements like a crazy psychotic woman the last month. But not because of me. Not because my levels were so low. No. I wish it was easy to say that. Like you get the big scare. Oh, I don't know how you're standing up because your levels are so low. You need to start taking better care of yourself. It wasn't that flipped me around. It was this. Yep, that's a positive. And just in case this isn't positive enough, took another one. This one mixed with this one definitely means, yep, I'm pregnant, which was pretty exciting. So what happened was, I was late, and well, let me back up a little bit. Some of you know that my husband and I were trying to get pregnant. We're going to both be 33 in April. We don't have any children. And, we just decided we wanted to be parents. And I really felt like I was going to have a really difficult time getting pregnant because I did have PCOS, polycystic ovarian disease, which they could find no traces of since I've lost the weight. But I really just didn't have much faith in myself. But when I found out my levels were so low, we purposely stopped trying, but we were not trying, if you know what I mean. But we weren't on a schedule like we were before, so wouldn't you know, of all the times to get pregnant, it happened then. And so on a Saturday, several Saturdays ago, my bladder woke me up about 5 a.m., and so I went to take the pregnancy test, and when I saw that it was positive, I ran at 5 o'clock in the morning, jumped on the bed where Jeff was sleeping, and I started waving around this in his face, which really scared him. And I don't know, because pea sticks to me, not that frightening, but he was pretty frightened by the pea stick. So, anyways, he was excited, and I'm excited, and yes, if there's any time that you get on track with taking your vitamins, it's when you're pregnant, because now, like, I am crazy about it, like, must get in every vitamin and mineral I can. Oh, extra folic acid? Take that. Oh, protein? You know, I'm, like, popping it all. Really hoping for a really healthy baby. It did hit me, however, the other day, and I had a slight little breakdown that I'm no longer in control of my weight. This is when I noticed that I've now put on 6 pounds. Not so good. Not good. I'm only, I'm in my 7th week of pregnancy right now. So, yeah, 6 pounds in 7 weeks. Not really what I was aiming for, but it hit me when I saw the scale that I was no longer in control of my weight gain. And I lost it. I couldn't imagine seeing the scales go close to 200 pounds again, which is what it will do if I put on the average weight amount for pregnant women. So, you know, I kind of, excuse me, that was fucking me, hair in my face. I was kind of panicking about that. I know that sounds crazy, and I know there's so many people have told me, it's not about you anymore, April, it's about the baby, and you need to put on weight. And I'm like, they really don't understand, most of them don't understand what we go through as bariatric patients, and all that I lost, and all of the effort you have to put into seeing each pound go away, and you hope forever. And even though I know that there's a life inside of me, and I'm going to have to put on weight, it's not the 30 pounds that scares me, because I know that most likely I'll lose 20 of that giving birth. It's the 60 pounds, the 70 pounds that scares me, like so many of my girlfriends have put on, which, by the way, are like tiny morsels. You know, and I'm thinking, what's going to happen if I have to put on 65 pounds? Will I be able to control it? And so I just kind of panicked. I'm meeting with the doctor on Monday. I'm having an ultrasound. And I'm also meeting with a nutritionist. And we're going to talk about, you know, healthy weight gain and that sort of thing. But let me tell you, I feel like I've been on an island for 4 days straight with no food. I am starving. It is really hard not to go to the refrigerator and eat food. And from what I've read, I only need to be putting in an extra like 300 calories a day, which isn't much for me because I only burn, let's see, around 1,400. So I can have about 1,700 calories a day, which seems crazy because I'm thinking, oh, I'm going to get fat. I'm going to get so big and fat. I was telling my husband, like, wouldn't it be cute if I was one of those women who just had, like, this cute little baby bump? And you're like, oh, look at her tummy. She's so cute. That's not going to happen to me. No. I'm going to have the butt bump, the thigh bump, the belly bump. I'm going to have the double chin bump. And I wouldn't be surprised if my nose became a bump. Like, you know some of those pregnant women get a nose like this? What's going to happen to me? But you know, I'm very excited. I'm very excited to be a first-time mother, and some people say that you really shouldn't go out and tell too many people when, you know, you're not out of danger. I say nay. No. I'm going to tell everybody because I have faith, and, you know, a life is a life, and I think it needs to be acknowledged. And I'm really looking forward to all the differences and the changes, and you know, I have the book, and so I'm reading like every day, you know, what changes happens to the baby, and you know, discovering different things, and it's really exciting. So I couldn't be happier. But I guess until the baby's born, my vlog is going to be more about what bariatric patients should expect if they get pregnant, more than it is about weight loss, because can't really be losing weight right now, can I? But it won't be long until I have to flip that back around and lose baby weight. So I just wanted you guys to know, and keep me in your prayers. I'm really wanting this to be a healthy baby, and gonna try my best to take care of myself and do what needs to be done. So, ta-ta for now.